Good day, everyone. I'm Risha Joyce Gavino, a junior nursing student, and my assigned topic are about the introduction of the sick young infant, the IMCI process, form and classification, and greetings as the first step of the process. So these are the infographics that I have made. On the next following slides, I will explain to you each of those. As we have learned, the IMCA process, which are assess, classify, and treat, is the same for young infants and children. However, as infants have some special care requirements, they are assessed for specific symptoms and signs. A sick young infant is a child up to 2 months of age, while a sick child is a child aged 2 months up to 5 years. So why are young infants special? Young infants differ from older infants and children in the ways they show signs of infections. They become ill and die very quickly from serious bacterial infections. Severe infections are the most common serious illness during the first 2 months of life. Special risk for low birth weight infants. Infants under 2.5 kilograms at birth are low weight. Infections are particularly dangerous in low birth weight infants. This means the infant had low weight at birth due either to poor growth in the womb or to prematurity or being born early. Infants often show only general signs when seriously ill, such as difficulty feeding, reduced movements, fever, or low body temperature. Newborn infants are often sick from conditions related to labor and delivery. Newborns with any of these conditions require immediate attention. Some infants are premature or born before 37 weeks of pregnancy. They may have trouble in breathing due to immature lungs. These conditions include birth asphyxia, birth trauma, preterm birth, and early onset infections such as sepsis from premature rupture membranes. Important care for young infants. Young infants have important care requirements to protect them from infection during the first months of life. This care includes: first, exclusive breastfeeding. Exclusive breastfeeding means that the infant receives only breast milk. Exclusive breastfeeding provides young infants with the nutrients and antibodies they require for healthy growth, development, and immune function. This also helps them fight off viruses and bacteria. Second, keeping infants warm. Babies can't regulate their body temperature as effectively as kids and adults because their bodies have more surface area by weight, causing quicker heat loss. Babies also don't have as much insulating body fat, especially sick or premature babies. Keeping babies warm helps them stay healthy and comfortable. Skin to skin contact helps baby's body self regulate, which stabilizes the heartbeat and breathing patterns. Third, immunization. Infants are particularly vulnerable to infections. That is why it is so important to protect them with immunization. Immunizations help prevent the spread of disease and protect infants against dangerous complications. Fourth, maintaining good hygiene. Infants are more at risk of infection because their immune systems are not yet fully developed. Good hygiene practice is important to protect them from infection, especially during the first few months of life. It also protects the mother and infant from getting or spreading germs and infectious diseases. To prevent the spread of microorganisms to the infant, wash hands every time and before holding an infant. Also, keeping the umbilical cord area clean to prevent infection. And fifth, seeking immediate care. Seeking immediate care, especially if the infant was classified as very severe disease to prevent unwanted death. Also, immediate proper care of infant is vitally important for survival, growth, and development of a newborn. Next is integrated management of childhood illness or IMCI process. This section in the infographic tackles about the IMCI process. The first part includes greetings, check all young infants for signs of serious illness, assess and classify sick young infant for jaundice and diarrhea, and treat the sick young infant. In the second part, it includes assess and classify sick young infant for feeding problems and low birth weight, breastfeeding, immunization, and other problems. Counsel a caregiver on feeding and counsel about infant care. Next is the IMCI form. This section in the infographic is the Integrated Management Childhood Illness form for the sick young infant. There are guide questions and follow-up questions that will determine where the sick infant will fall on the classification of color. Each of them will be tackled on the following infographics of our group. This part in the infographic is about the IMCI classification for sick young infant. After assessing the sick young infant, there are specific findings that will fall in the three different colors, which are the red, that stands for urgent referral of the sick young infant, yellow, that stands for treat in the clinic, and green, that stands for treat at home. The certain findings during the assessment in every color will be tackled on the following infographics. For red, which is urgent referral, it includes pre-referral treatment and refer urgently. For yellow, which is treat in the clinic, it includes identify treatment, treat, counsel caregiver, and follow-up care. For green, which is treat at home, it includes identify treatment, counsel caregiver on home treatment, and follow-up care. Next, this part in the infographic shows the importance of greetings as the first step of the IMCA process. The first step in the IMCA process is to greet the caregiver and ask about the child. Greeting the caregiver has two purposes. First, greeting makes a caregiver feel welcome in the clinic. Greeting and welcoming a caregiver is an important first step in building trust. It begins good and caring communication. Second, it helps you to gather important information, specifically about the infant's name, age, and problems. After that, ask whether it is initial or follow-up care and measure the infant's weight and temperature. So why is good communication with a caregiver is important? Caregivers can be very stressed and emotional when her baby is ill. It is important for health workers to communicate concern and care for the infant's health and the family situation. Good communication helps to reassure the caregiver that her baby will receive a good care. When you treat the infant's illness later in the visit, you will need to teach and advise the caregiver about caring for her sick child at home. Good communication and trust is essential here. It is important to have a good communication with the caregiver from the beginning of the visit. And that was all about my assigned topics. Thank you and have a nice day.